So every Friday, we do this little thing around here called Let's Talk NCLEX, and it is our opportunity to assemble together to go over the latest and the greatest NCLEX information for those of you who are testing in the next coming weeks. Hello. Rocco, thank you so much for being here with me. If you guys are not familiar with who I am, I like to say I am the greatest NCLEX instructor in the world. My name is Regina Callion, and I work for this amazing company called ReMar Review. And you know, the greatest thing about this company, yes, we have an amazing staff who work so hard to meet every one of your needs. But we also have the #1 nursing students on the planet. And I mean, literally nursing students from all over are a part of the ReMar nurse family. And we are single-handedly closing the gap of the nursing shortage because our nurses are passing every single day. And I'm not just saying that. We have video testimonials to prove it. So if you check out the website remarnurse.com, you will see the video testimonials from our nursing students in the United States and internationally as well. We love our international nursing students. Congratulations to Nurse Abshire, who says, I passed after 75 questions. Thank you, ReMar, for helping me achieve my goals. Oh, yes, that is what we do. We shout out to you guys who send us the wonderful video testimonials. You know, send us the video testimonials. Tell your story. You are a testimony to literally thousands of nurses who will come behind you. There are so many people who want to get into this NCLEX. They want to get in this NCLEX pool with you guys, but they still have to go to nursing school. So they're looking to you for motivation, and where you are right now will encourage somebody. I got Orlando, Florida in the house. Thank you for being here with me. I know I have nurse students from all over, but there's something about Orlando that has my heart. I love going there. I love taking my kids there. And there are so many ReMar nurses living in the Florida area. I think just because it's just so many nursing schools down there. But I'm here to do Let's Talk NCLEX. We will get into, thank you. We will get into all things NCLEX. But you know what? Do you guys know what I am so excited for? Here at ReMar, we have these events, right? We have these events that we do, and we put them on, and they're totally free for you guys. And we do free giveaways and free NCLEX reviews. And I mean, we just have a great time around here. But there is one event, you guys know what it is. There is one event that happens every year that surpasses them all. And people ask us about this event all year round, but it only comes once a year. Do you guys know what the event is? Oh my goodness. Have you never experienced 7 days of NCLEX? It is the season. It is the season for this wonderful event. And literally 7 days of NCLEX. Trinidad is in the house. Hey, literally 7 days of NCLEX is everything that you could ever dream of if you are preparing for the exam. Literally, you and I will spend 7 full days starting the day after Christmas. The day after Christmas, you and I will spend 7 days. Day 1, we will be going over NCLEX. We will be going over the NCLEX overview. We'll be doing a practice exam. And let me tell you guys, well, let me not tell you guys this. I won't say it. Day 2, we will be doing the hottest topics for NCLEX. The hottest topics. Hey, congratulations. Ran out of time, but passed my NCLEX with ReMar. Oh my goodness. Congratulations. Because you know what? That just caught my attention, because you know what? Usually people who run out of time on their NCLEX exam, the majority of those people do not end up passing. They don't end up passing. So the fact that you ran out of time, but you still passed, congratulations. Oh my goodness. I am so, another one. Charlotte, Nurse Charlotte, you passed your NCLEX RN for the first time Monday. Whew. Congratulations. It is the season of miracles. People are passing their NCLEX. Are you the next person to pass your NCLEX? Thank you for coming on here and telling me that you guys passed your NCLEX. This is what I'm talking about. We are a family of nurses who study together, but then we take the test and we pass. And it's so important. Send us in your testimonial videos, because I know when you ran out of time, your heart probably was like dropped. But I'm so glad that you stuck in there and then you didn't give up, because sometimes after we hit a certain amount of time or a certain number of questions, when we're testing, it discourages us and we take ourselves out of the fight, because we think, oh, I got over 75 questions, or oh, I got over 200 questions. No, you have to stay in there. You have to be prepared to take the whole exam. You have to go in there prepared to sit the whole 6 hours testing. All right. So in your minds, get in that mindset right now that you're going in there for a fight. And let me tell you guys this, while I'm talking about the NCLEX and doing 7 days of NCLEX, it is going to be great. It is going to be amazing. It is going to be the biggest help for those of you who have purchased packages during Black Friday. And those of you who are actively studying right now, this is coming at the perfect time for you, because ideally you should be ready to take your exam around New Year's or even sooner. So this 7 days of NCLEX will be so important for you. But I'm going to encourage everybody that's watching me to take your NCLEX exam serious now. I mean, because this morning, Candace, I know you're ready for the battle. This morning, I spent about 2 hours just studying and just anticipating the changes of the exam. And so I'm going to be talking a little bit more about this for the 7 days of NCLEX. But on day 3 of 7 days of NCLEX, we are doing pharmacology. And I have already completed the pharmacology review for you guys. And I'm preparing it for the next generation of NCLEX test takers, because as they are making changes to the exam, and literally, let me tell you guys this. So that one of the lead developers of the NCLEX exam said today, I heard him say today, the NCLEX exam is the premier NCLEX testing. You know, it is the premier NCLEX test in the world. There is no other test like it. And he said, that is a truth. And I totally agree with that. There is nothing like this NCLEX exam. You don't come across it in nursing school. You don't come across it in the public. Like, you can't buy a program like the NCLEX exam. But what he said is that through the research that they have been doing, and he went all into the details about the research and the findings, but the end result is that this current NCLEX is not reliable to predict how a nursing student critically thinks. And so they're realizing that, as amazing as it is, there are certain areas of your knowledge that the exam is not able to assess. And that is a problem. That is a problem for the stakeholders of the exam. And ultimately, that is a problem for public safety and the hospitals and facilities that you will be working with. So what they're doing is they are making a big play to totally change this NCLEX exam. All right. There are some things that they are getting ready to do that you absolutely, if you don't have to be taking the new NCLEX exam, you don't want to be. Like, for example, he was talking about today how in the 21st century, most nursing students have access to tablets or electronic drug guides and things. And so what they are planning to do for the future NCLEX is, instead of having you memorize drugs like we currently have to do now, it won't be necessary for you to memorize a drug and its and what it does and what it's for. On the NCLEX exam, they will give it to you. They will give you a drug reference guide because the clinical scenarios are going to be so much more involved that they're just going to give you information. They're going to give you information and see how you synthesize it. So these are one of the things that are going to have to be addressed for educators when they're preparing you all. And so I am diligently studying like a little, I don't even know, like a little elf, I guess, to get you guys ready for these new changes. Now, I don't expect these changes to happen on the next NCLEX exam. I don't expect the kind of changes he was talking about this morning. I don't expect for those changes to happen for the 2019 RN exam, but maybe pretty soon after that, because they may start gradually integrating these types of questions, and they're basically just new types of questions and new presentations. So I'm saying all this to say, let's get ready to test now. Let's understand our foundational informations now. Let's study together. Because there may even be parameters for how NCLEX instructors are even able to teach you guys, or what we're allowed to say, or what, like right now, everything that I'm learning, I tell you guys. I just get on here and I tell you guys, I have no problem doing that. I can't keep a secret. But there may be parameters to even how we are to educate you, and what things we can say and what things we cannot say. So today I realized that the landscape of education for the 21st century will require so much more. It will require so much more preparation for you guys when it comes to your state board examinations. So let us take it serious now. And going back to our 7 days of NCLEX event, day 3 is pharmacology. I think 3 is pharmacology, I believe. So when I was preparing the pharmacology for you guys, I basically made it in advance. This will be an advanced pharmacology session. So if you have the 5-star quick facts, I am going directly from that book, and I'm assuming that you already know the foundations of the medication. So when you come to the pharmacology review, understand that it will be all synthesis, it will be all application and evaluation. And I think Mark is working on the link right now for you guys to register, so that you can get information about the event, get the workbook, and all those things. Okay. So I'm telling you guys, don't miss the 7 days of NCLEX, because it is going to be really insightful for you guys that are studying. It's going to be a big help, and literally it's a free NCLEX review right after Christmas. So enjoy the holidays, but mark it in your calendar to spend all 7 days with me. So we're going to do hot topics for NCLEX. These are topics you don't want to miss while you're studying. And that will probably come from Quick Facts and the DVD program. Also, we're going to do the pharmacology. We're going to do, I've been getting requests, so I'm going to do 2 full days of NCLEX review. I am including Psych in there. I wasn't going to, but I got so many emails like, Regina, you never do psychiatric nursing. So I am preparing a psychiatric nursing review for you guys to get you prepared. We're going to have homework. We're going to have practice exams. And then on New Year's Day, I will be spending it with you guys. We're going to have our open house for NCLEX, which is where we talk about a whole bunch of stuff. And I should be able to present to you guys the changes that you are requesting. I'm expecting all the changes to be out by then. And so I will have a formal presentation. And I also, congratulations, Nurse August. Where are you from? You're officially a U.S. registered nurse. Tell me where you're from. I'm excited to know. I want to know. And congratulations. So I am expecting for everything to be released, and I'll be able to talk to you about the ways that I am anticipating changing, teaching you guys the things that you should be looking out for. Again, I don't want to scare anybody. I don't think that the 2019 RN exam will have these major changes. I don't think it will. I just don't think that I don't think anybody is ready for them. I don't even think the NCLEX is ready for these type of changes that they want to do. So I don't see it in the future. I think maybe 2022, maybe 2022. So I definitely want you guys to be there though, so that we can talk about it. So it will be various times, 7 days in NCLEX. Hold on. Crystal Dickerson. Hi, ReMar. Hi, guys. ReMar is the truth. After 3 years with my third attempt, I passed NCLEX last Saturday. I walked in with confidence. Wow. Please invest. Do the 7 days. I know. I'm trying to tell him. I'm a ReMar nurse, and yes, she knows what she's talking about. He will see you. Oh, yes. About you will see this again. Thank you times 1,000. Thank you, Nurse Dickerson, for coming on here. I appreciate you. Oh, you're from Ghana? Graduated 7 years ago, and you got your USRN. Congratulations. Congratulations on here. Hey. Okay. So 7 days of NCLEX, you got to check out the schedule because each day there will be a different time, mostly in the evenings. Praise God for 7 days of NCLEX. It will be a major event. But when you sign up for it, when you see the link, you will get the times of your NCLEX review. Okay, because every day will kind of be like a different time because I'm not going to have you guys on New Year's Eve at night with me. We're going to do New Year's Eve earlier. So if you have plans, I'm going to accommodate you guys. Okay. So it will be great. Okay. So NCLEX, it is what it is. We all have to take it. We all have to pass it. And so we're working really hard to make sure that you all do. Not too long ago, I was in your shoes. And Nurse Dickerson and Nurse August, we were all in your shoes, and we were studying for the exam, and we were hoping and praying that we would pass it. But we are here to tell you guys today that the things that you're studying, keep studying, okay? ReMar Review, we put out products, we put out programs that will be super helpful to you, but you have to trust the process. And so many of you have had bad experiences during this studying process that you don't have a lot of trust and you don't have a lot of confidence, but you have to have those foundations. You have to have those foundations in order to pass, okay? And even those of you that experience failure, I understand that it is tough to try again when there's so many reasons why. There's so many reasons why you don't feel like doing it. You don't want to try again. You don't want to tell people that you're studying for NCLEX again. But I promise you, it's worth it. It is so worth whatever little inconvenience that you have now once you get your nursing license and once you're able to go to the job of your dreams and go to nursing as a registered nurse as opposed to a nurse's aide or a transport worker or wherever you're working at now that's not in nursing. It'll be worth it. And so you can't give up. Okay. So let's get into it, shall we? Let's get into it. You are here for Let's Talk NCLEX. So our first question comes from the Instagram page. Hi, everybody that's just joining. The Instagram page, did you see this one? So here it is. ReMar nurses, look at this little baby. Which simple diagnostic procedure is this child in position for? Which simple diagnostic procedure is this child in position for? Have you ever seen this before? Somebody knows, looking at this baby, what they are going to have. It's a simple diagnostic procedure. Anybody? Is there one? And as people are like, what is this, Regina? I don't know. But when I saw it, I was like, oh, yes, I will ask this on Instagram. Yes, everybody's saying, okay, you guys know. Yes, this little person is definitely in position for an X-ray. So child is in position for an X-ray. This is immobilizing the baby so that it reduces the time actually that it takes to get the X-ray done, because you have to be super still when you get an X-ray done. And little babies, they like to wiggle, they like to move. So if you literally clamp them and immobilize them, you can get the X-ray done. It's less time for them to be exposed to radiation. So it's a good thing. It's a good thing. That was our Instagram question for this week. Hey, if you are on Instagram but not following ReMar Review, shame on you, because it is another opportunity for you to study for this exam. All right, you guys got that one right. It's super cute. I love the way it looks. We have our Facebook question coming up, and then we're going to do a little bit of Ask ReMar, because I got some really good questions from students this week, and I just want to share it with you guys. So this is our question. Shout out to my nurses in Jamaica. I appreciate you guys for all the emails that I'm getting. Oh no, the formatting here. Oh, okay, let's see here. Let me check the formatting on this one. It happens like that sometimes. All right, let's do Ask ReMar first, and then I'll have Mark to work on that one. Let's do the Ask ReMar. It simply came from a nurse, and she says, hey, Regina. She says, hold on once. She says, hey, Regina, with psych patients, which is a more concerning priority? So with psych patients, which is a more concerning priority? Who would the nurse see first? One, a patient stating he wants to engage in self-destructive behavior, or a patient who is threatening the staff. So here, psych priority questions are really tough sometimes, because we always try to go with like airway, breathing, circulation. And usually it's never that when it comes to psych. So what do you guys think? Who needs the nurse first? Somebody who says that they are wanting to engage in self-destructive behavior, or a patient who is threatening the staff? A nurse sent this to me this week, and I thought this was a really good review question to go over for you guys. So I see a lot of people saying one. Yeah, one. Okay, so the best way for us to look at this, I believe, is to let's just start by, as I see some people that are picking two. Let's just start by defining the patients in each one. So the first patient, he is said to have self-destructive behavior. So when you think of self-destructive behavior, this is a term that is generalized, okay? And I think that we need to review it, because some of our misconceptions are we automatically take it to suicide, right? When you think of self-destructive behavior, you think, oh, this person wants to commit suicide. However, if you look up the term self-destructive, Self-destructive behaviors are more like self-sabotaging, right? So self-sabotaging behaviors that would keep a person from achieving a certain type of goal, right? So I like that. I like that. All right. So self-limiting behaviors. All right. So let's think about it in that context. And let me give you a list of self-destructive behaviors. So self-destructive behaviors here. All right. And look, you do not see suicide, okay, here, but there are examples such as drinking alcohol, overeating, cutting yourself, verbally lashing out, right? Because when you do that, that is going to put you in a position for a potential argument, okay? Avoiding other people, isolating yourself, using drugs, eating disorders, gambling. These are considered self-destructive behaviors. So what I'm doing now is just defining the two patients, because it's easy to just automatically pick something. But we have to come from a place of knowledge in order to get these kind of questions right on the NCLEX exam. So we have a patient who says they want to engage in self-destructive behaviors. Now, NCLEX didn't tell us what those behaviors are. They just said that it's self-destructive. So this is one patient. The next patient was talking about threatening somebody. When you threaten someone, that is, what does that mean? Let me ask you, what does it mean? Do you know what it means? When you threaten someone, it is your intention to take hostile action, okay? You are intending to do harm or kill somebody. So I asked again, knowing the context of the question, knowing these two patients now, who would the nurse see first? A patient stating he wants to engage in self-destructive behavior, or a patient who is threatening the staff. Yes, that is correct, everybody. Now everybody's like, whoa. I made a mistake. I want to change my answer. Of course. It is number two. Okay. And this is just a really great way that for us to review just things. Sometimes it's good to just come on during the week and talk about NCLEX, because you have to be in a certain mindset to answer these questions. And they like to trip you up, and they like to throw things in there that are distractors, right? And they like to throw things in there that will confuse you. And so it's really easy. It's very, very easy for that to happen when you assume things. Okay, so that was a good question. Let's do another one. Here we go. A client is admitted to the hospital with a diagnosis of paranoid schizophrenia. This is our psych review. Okay, so the client has paranoid schizophrenia. Do you know what that is? The client states, if you come any closer, I will die. Which perception disorder is the client experiencing? 1, delusion. 2, hallucination. 3, idea of reference. Or 4, illusion. We're talking about a client with paranoid schizophrenia. Everybody that has DVD self-study program needs to get this right, because I definitely go over this very, very, very basic NCLEX question. I definitely go over this very, very, very basic NCLEX question. All right. And I need the answers to come in for you guys. I need the answers to come in. They are. Everybody's saying 3, idea of reference. Oh, everybody's saying 3. Some people are saying 2. Come on, guys. Come on. You can do it. You can do it. I believe in you. I believe in you. All right. Let me give you guys the answer. The correct answer is going to be delusion. Delusion. Yes, it's a false thought. It is a false thought. You guys, one of the things about psych that makes psych really, really, one of the things that makes psych, I think one of the things that makes psych tough is just the amount of new vocabulary that nursing students have to engage with. And so it's easy for us to look over words and just read them in the context of the study material. But if you see them outside of that context of the study material, then we don't know them as well. And so definition work is one of the fundamentals, and it's one of the ways that I prepare you guys. If you have DVD number 4, you know a delusion is a false thought. Now, the difference between a delusion and a hallucination is what? What is the difference between a person having a false thought and a hallucination? Because hallucinations are false too, right? So what's the difference? No. Okay. So yes, you guys, yes. Okay. So the hallucination is a false thought, but it has a sensory component to it. It has a sensory component to it. So where a delusion is, okay, if you come any closer to me, I'm going to die. That's something that you think in your mind. But if it was a hallucination, the person would say, I see you floating closer to me and I'm going to die. Or I see you and you have 10 arms. Okay, so it involves a sense. A hallucination example would also be, I hear you saying you're going to kill me. Like, that's a sense, right? Your sight is a sense, your hearing is a sense. Another example of a hallucination would be, well, I taste blood. You're giving me this water, but it tastes like blood, right? So that is an example of hallucinations. So nurse says, patients think their robe, patients think it's a robe and think it's a snake. Okay, well, if a patient just thought it was a snake in their minds, that would be a delusion. But if a patient says, that robe over there looks like a snake, or that robe over there has a head of a snake, that's an hallucination. So you want to know definitely the difference between these two. All right. So it's a sensory component. And those are the two that I usually see when I am doing NCLEX questions and they're psych related. All right. So being able to understand schizophrenia is really important, because those are the type of patients that have a problem with interpreting reality correctly. All right. So let's do another one. Let's do another one. Here we go. A client is admitted to the hospital with a diagnosis of paranoid schizophrenia. The client states, if you come any closer, I will die. I will die. So this is the same thing, but the question is different here. Which is the best response by the nurse to this statement? Which response is the best to a client saying, which response is the best to a client saying, if you come near me, I will die. If you come near me, I will die. Is it number 1? How can I hurt you? I have no weapon. Number 2, I am your nurse today. 3, why are you afraid? 4, you are not going to die. And I apologize because all of these are not questions, and I don't know if it's the formatting, but all of these, except for number 3, should have periods at the end of them. They should not be questions. So I'm glad that you guys are answering anyways with I apologize, with the correct punctuation at the end. So the choices should be, how can I hurt you? I have no weapon. 2, I am your nurse today. 3, why are you afraid? 4, you are not going to die. And remember, when you're talking about addressing a psych patient that is paranoid or confused or afraid, you never want to ask them why. Why? Okay? Because all that does is draw them more into the thought, right? All that does is bring them more engrossed into the fear, because now they're about to tell you why they are afraid. So you don't even go there. Don't even go there. If somebody says, I'm the president of the United States, don't ask them why they believe that. Don't even go there. What you need to do is what? You need to present reality to that patient. So if somebody says, I'm the president of the United States, you say, your name is John Smith. You're a patient here at the hospital, right? If somebody says, everything that they're bringing me is poisonous and the staff is trying to kill me, you tell them, all the food that you have is sealed by a factory. No one here is making your food, right? So if we go back to the choices, the correct answer is going to be, the client says, this is what the client says, if you come any closer, I will die. The next response by the nurse, the best response is, I am your nurse today. I am your nurse today. And that is because it presents reality to the patient. Number 1, telling the patient, I have no weapon. That's not going to help the patient, because he can say anything. That could, like, he could say, you're going to kill me with your mind, or something else like that. Okay. So we're not going to draw attention to any kind of physical object, because this is not a physical battle that you're in. Somebody knows what I'm talking about. Sometimes you be in spiritual battles with these patients because they are, so that is not going to be the correct answer. 3, why are you afraid? We don't want the patient to tell us why. We don't want the patient to tell us why. We're never asking why. All right. And then 4, saying, you're not going to die. You tell a patient that, then what that is doing is ignoring their feelings. Okay. And you want to be therapeutic. Part of psych communication for NCLEX, it always has to be therapeutic. They always want you to reassure and comfort your patient. So you cannot ignore the response of a client. So if a client says to you, I'm concerned about this procedure, your response as the nurse can never be, we'll tell your doctor. We'll talk to your doctor about that, because that is shutting the patient down. You're not addressing their concerns. The question is always, tell me more. Tell me more about it, because you want to facilitate that communication. You want it to be therapeutic and reassuring to your patient. So these are major points for psych. And I've decided to do this. I've decided to do this for the 7 days of NCLEX. So I hope that you guys can join me, because we will definitely devote some time to psychiatric nursing. Let's do this question here. We'll go back to the questions. Okay. So here we go. This is about medication. All right. Which of the following statements indicate that a client's antipsychotic medications are having a desired effect? Number 1, the client reports joint stiffness. Number 2, the client states, I feel restless. 3, the client states the voices are not as hostile. 4, the client has an increased sleeping pattern. We are looking for the sign, the statement that the antipsychotic medications are working. Which one? The client reports joint stiffness. The client states, I feel restless. 3, the client states, the voices are not as hostile. Or 4, the client has an increased sleeping pattern. I see a lot of 3s. I see a lot of 4s. I see a lot of 1s. Which is going to correctly identify We're looking for the right answer, not the wrong answer. I feel like you guys are picking the wrong answer. We're looking for the right answer to verify that things are working or things are improving. Things are improving. Come on, guys. Right? This is one of the reasons why questions are great after studying the information. This is why. Because sometimes when we just go straight to questions, we just pick anything because we really don't know. So we're trying to make connections. That don't necessarily add up. So I come here and do questions with you guys, but I stress the content first. So let's go over it. The correct answer, change your mind. Go ahead, Candace, change your mind. The correct answer is going to actually be yes, number 3. The correct answer is number 3. The client states the voices are not as hostile. So one of the desired effects of an antipsychotic medication is that the patient will ultimately lose those positive psychotic symptoms. So they'll lose their hallucinations, they'll lose their delusions. But as part of an improvement, the patient will notice that the voices are not as loud, they're not as threatening, they're not directing them to harmful practices. That is actually considered an improvement, right? That is actually considered an improvement. So the next time that you're thinking about symptom relief in the psychiatric patient, understand that number 1, it's a gradual process. It's very, very gradual. Most mental diseases, most mental disorders are lifelong and they're chronic. Okay, so people struggle with them their entire lives, and we as nurses, we have to understand this fact that these people really are sick. They really are sick, and they need a lot of patience, and they need a lot of education, and NCLEX understands that. So a lot of the questions are geared towards education. What do you know? What do you know about this psychiatric condition? Because we as nurses, we're not ordering medications. Like, we're just administering these, but we have to understand the principles to help the client stay on the medication. Because as you're studying for NCLEX, and you guys know with the review that I do with you guys, there are a lot of side effects to psychiatric medication, and they are not fun to take. And some of them are very, very harmful, even though they will help you mentation-wise, physically, they create other issues in the body. So some psychiatric medications will cause you to have diabetes, but the doctor and the nurses still have to encourage the patient, take these medications, right? We still have to tell them that. Some medications, some psychiatric medications will have patients drowsy. They will have them like constipated. There'll be all these things, right? All these things. And so we have to understand that it is very difficult to stay on a psych medication. And that's why there are a lot of people, we see them homeless, you see them out on the streets and they're walking around, and we just think that they're just crazy. Like, we just think they're just crazy people. They don't want to do what's right. But no, they're making a decision to live with their mental illness as opposed to taking these very harmful drugs that can cause them to have a stroke. Some psychiatric medications, they tell you, if you take this, you're at increased risk for stroke. So who would want to take this medication? Literally. So it's very important for us as nurses to be compassionate and therapeutic to our psychiatric patients. And that's my hobby horse, because sometimes we have prejudices. How do you say it? Prejudices against people based on their diagnosis. So let's do this question here. This was the first question. What is the first action that a nurse should take after overhearing a registered nurse making a disrespectful comment about a coworker? This is our Facebook question of the day. What is the first action that a nurse should take after overhearing a registered nurse making a disrespectful comment about a coworker? Number one, advise the nurse that this type of behavior is undesirable. 2, encourage the nurse to apologize to the coworker for the statement. 3, ask the nurse to give a reason for the statement. 4, document and report the comment to a supervisor. Oh, there's so many answers coming in here. What? This question is how we relate to our coworkers. If you hear a coworker saying something disrespectful, inappropriate, unprofessional about another coworker, what are you to do for the NCLEX? What are you to do for the NCLEX exam? Shall you tell the nurse, you know what, that's inappropriate, and that kind of talking does not belong here in the workplace? Or should you encourage the nurse to apologize? Should you say you should go and apologize for saying that because it was unnecessary? You should go and apologize and say that. Say, because it was mean-spirited. Should you 3, ask why? Ask the nurse, well, why did you say that? What is it about the coworker? Well, what happened? Nobody should pick 3. No. Or should you 4? Look at the coworker, smile, and then write a note to the supervisor saying all that you heard, saying all that happened. You know, some people do that. Some people will look at you, agree with you, smile in your face, and then you know what they'll do? They'll write a letter to the supervisor and say, you know what Nurse Jones did today? You know what she said today? It was totally inappropriate. But NCLEX. What NCLEX wants you to do, what they want you to do is shut this conversation down. Shut the conversation down. Advise the nurse that this type of behavior is undesirable. All right. Just tell the nurse this kind of conversation is not appropriate for the workplace. And that's okay for you to say, because that is okay for you to say. That's okay for you to say because you're trying to prevent a situation from occurring. Okay. You're trying to prevent a situation from occurring. So you don't want to try to make an actionable step while you're trying to encourage the nurse to go apologize to the coworker, because what is that going to do? That's going to escalate. That is going to escalate the situation. And congratulations to those of you who got it right. That's going to escalate the situation. 3, ask the nurse to give a reason for the statement. No. That not only will escalate the situation, that will encourage the discussion more. So the whole thing is trying to shut down the discussion. You don't want You don't want the discussion to continue on, all right? You don't want the discussion to continue on. 4, documenting and reporting it to the supervisor is not appropriate, okay? It's not appropriate. You don't want to escalate this. You don't want to escalate this to the supervisor because it's not something that's escalatable, right? Right now, it's not escalatable. Maybe this person just needs education, and you as a nurse, you're able to do that. You're able to advise someone when something should not be done, right? You're able to step in and say, that's not appropriate for the workplace. The nurse is not doing anything to harm the patient. No harm has been done. So there's no reason to get the supervisor involved at this time. Now, what would happen is if the nurse said this is undesirable and the nurse continued to go on and on and on, then the supervisor should be called. But sometimes it's okay to make the initial advice that this needs to be stopped, right? And it's just the same as, I think we did one not too long ago where we said there were 2 nurses' aides arguing in the hallway, right? These are the kind of scenarios. These are the kind of scenarios where NCLEX puts you in. There's 2 nurses' aides arguing in the hallway. And what should the nurse do? Okay, the nurse should advise them that they need to stop yelling in the hallway. And that's okay for the nurse to do that. That's okay for you to do that. All right. So with this question again, it is the first step of the nurse. We're looking for the initial step. So don't forget those key words there. The initial step of the nurse is going to be to advise that coworker. We don't talk like that around these parts because it's not helpful. So, hey, everybody, 7 days of NCLEX. I have to remind you before I go one more time, look out for it. It's going to be amazing. It's going to be amazing. Shout out to you guys who got at least 2 of the questions correct today because they were tough. But don't worry, we do this. Hey, Mark says the link is up right now to sign up for the event. Sign up for it. You will start to get information. You'll get that calendar so you can know the times so that you can plan to be present for this event. Because you know what? This event gets ghost after January 1st. All right. So we don't leave this up all year round. It's just a blessing for the holiday season. So we're not going to leave this up into January, February, March. I'm telling you, you don't want to miss this review because I'm giving you guys updated information. I'm giving you guys new information. I'm helping you. These are like advanced study sessions for you guys who love to dig deeper. If you like these questions today, then you will love what we're going to do during 7 days because I'm putting the questions up to the top of the clinical thinking, Bloom's taxonomy. These are higher level questions. So there will be a link on the Facebook page, on the public Facebook page. We'll probably put it in the study group as well for you to sign up for 7 days of NCLEX. Look for that link because I cannot email them to everybody. I cannot email them individually. There will be thousands of people who will sign up for this event with me. And I'm so happy because it is going to be amazingly, and most importantly, it's free. It's totally free. So you don't have to pay for anything. You can put on your Christmas pajamas, get in front of the computer, if you like, print out your workbook. And then you can go over the information with me. Yes, there'll be homework to do. Yes, there'll be preparation that you will be required to do, but it is all part of the process. And that's what makes it fun. I think you guys like this scarf. Thank you very much. I believe I got this a few years ago, and I want to say I got it at Walmart actually, but at any moment, it's the holiday season, and here at ReMar Review, we love to give gifts, but we also love to get gifts, but we also love to give you gifts as well. So Mark, they're asking you to post it in the link here on the video. You guys are taking weeks off of work. I'm glad you're taking the time off. When you get the calendar, look at the dates and times to make sure that you're available. I am still working on the workbook, but I have completed this the pharmacology review, which took me like 3 weeks to do. Okay. And the reason why is because I was trying not to get too deep, but I'm really focusing on drug interactions and understanding how drugs communicate with each other. And so that is the point that I'm coming from. And so, like I said, this is an advanced study session. Don't show up if you're not really ready to study. Don't show up if your mind is going to get fatigued easily because this is intense. All right. So every Friday until 7 Days of NCLEX, I will be talking about this event. So don't worry if you missed it, if you're just coming on. You will get more and more details. You will start to see the videos for 7 Days of NCLEX, and you can just tell a friend, okay? And maybe we can have a watch party, or maybe we can all just do it together. So I will probably be sending the workbooks out next week. I'm shooting for Monday, but I still have to finish compiling the last 2 days of the NCLEX review. So don't rush me, because the review doesn't start until December 26th. So I have time to prepare for you guys. And so I want to make sure that it is the best that it could be. Okay. And I like that. Give yourself the gift of being a registered nurse or a licensed nurse this holiday season. And it's easy to do because all you have to do is show up to the review. And I'm telling you, I'm going to tell you the things that are on the exam that are important for you to know. So if you will join me, I look forward to seeing your name in the registration for the event. All right. So I won't hold you guys. It's Friday. We will be back on Monday to get our Monday motivation right here, ReMar Review. And also, we're going to come back on next Friday. So Mondays and Fridays until 7 Days of NCLEX. And then it's Wednesday, Thursday, Friday, Saturday, Sunday, Monday, Tuesday of NCLEX. So we are praying for everybody. We're praying for everybody that is testing soon. We get your prayer requests. Actually, on Mondays, the staff, we all get together and we do the prayers at that time. And we just pray for you guys. So it's definitely something that we are actively doing for everybody testing. We're praying that you don't have anxiety. We're praying that you, yes, Mark prays. We're praying that you don't have anxiety, that you feel prepared, that you're confident, and that actually that you're studying like you know you need to be. So I will see you guys on Monday. Have a great weekend. Supported ReMar Review. If you guys need to email about products, concerns, prayer requests, please go ahead and email there. And then we will get your question answered. It's really hard when you guys post to like the videos or the group or things like that, because we don't always have staff checking those. So please use the email address to contact me if you have any questions. Like just reach out to us. Honestly, we are here to serve you guys. We want you guys to get the products that you want. I know you have a lot of questions about what's great for me, what's best for me. So let us help you choose the program that's going to work best for you. We have programs. It doesn't matter if you haven't been to school in 10 years. It doesn't matter if you just graduated last year or if you are graduating in the next couple months. We have a program for you here at ReMar Review. So I will leave us with our class motto: we can, we will, we must pass NCLEX. Have a great weekend, guys. Bye.